Nolan Guxel. Today we're going to be going over the respiratory therapy assessment competency. So the first thing we want to do before entering the patient's room is review the patient's chart, make sure there's no pertinent information that may pertain to us, look for physician orders, things like patient isolation, contact precautions, anything that may pertain to us. Then we're going to go ahead and gather supplies. For this I want my stethoscope, I have my vitals machine with blood pressure cuff, thermometer, I have my pulse oximeter, alcohol wipes for my stethoscope, gloves, and then something to record on as well. So I'm going to go ahead and sanitize. I'm going to enter the patient's room, and I'm going to enter while I'm sanitizing my stethoscope. Go ahead and introduce myself to the patient. Hello, my name is Nolan Guxel. I'm a respiratory therapy student with Cardinal College. How are you doing today?
Good, how are you?
Good, thank you. And your name?
Adeline.
Adeline. And Adeline, can you tell me your last name as well as your date of birth?
Adeline Ramirez, 4/14/98.
Okay, I'm going to go ahead and confirm that with the patient wristband. Okay, so patient identifier has been confirmed. I introduced myself, so now I'm going to explain the procedure and obtain consent. So today we're going to be doing a respiratory assessment. With that, we do an assessment of your comfort and your pain, then your cardiovascular system in your heart, and then your respiratory system at the end. Is that all right?
Yeah.
Okay, so there is the procedure as well as consent. So after that, I'm going to go ahead and apply gloves. I'm going to provide patient privacy at this time, so if there's family members, I can ask if she feels comfortable with them staying, close any curtains, mute TVs, anything to limit distractions in the room as well as provide privacy. At this time as well, I'm going to look for any hazards in the room, so any free-floating oxygen tanks, IV lines, anything that may be a hazard for the patient and I walking around. I can go ahead and look to see what type of oxygen delivery device they are on. Doesn't pertain to this situation. She's not on oxygen, but I can look for liters per minute and FiO2 as well as the device. So I'm going to go ahead and raise the bed just a little bit to a comfortable working level, okay? I'm going to go ahead and put this pulse oximeter on you. It's going to measure your pulse as well as how much oxygen you have in your blood. So I'm going to leave that on there. Read the recording. Okay. We're at 98% and a heart rate of 68. We can look for the pleth on this, make sure we have full equal bars to determine an accurate reading. After that, we're going to want to obtain a set of vitals. So we're going to do a blood pressure, heart rate, temperature, respiration rate, and pain. Start with your blood pressure. So we're going to take a blood pressure for you right now, okay? We go ahead and lower this rail. Follow your right arm. It's going to get a little bit tight. We're going to bring it back down as quickly as possible, okay? Blood pressure is 128/86. I'm going to go ahead and make note of that. Take this off your arm. Are you in any sort of pain right now?
No.
Physical pain. Pain. All right, I want to take your temperature if you don't mind.
Okay.
Can I have you put that underneath your tongue? Thank you. Just one more time. Is that under your tongue?
Mm-hmm.
Okay, thank you very much. I'm going to record our temperature, 98.6 Fahrenheit. Alrighty, I'm going to go ahead and take your pulse now for 1 minute, alrighty? Lay this across your chest. Thank you very much. So we went ahead and did pulse for 30 seconds and then respirations for 30 seconds. So we had 32 beats per minute. That's times 2 is going to be 64 beats per minute. And then 10 respirations, so that's going to be 20 respirations in a minute. So we already did pain. So that is our initial set of vitals. We're going to go ahead and go into the neurological assessment now. So as noted in our vitals, she's not in any pain right now. As I entered the room, she's able to track me with her eyes, and she's forming good, complete words as well as sentences. So are you having any trouble swallowing today?
No.
Okay, are you eating and drinking well?
Yes.
And can you cough for me? Okay, so she can cough, so she has a gag reflex. Do you usually use any glasses, hearing aids, or anything else?
Yeah, glasses.
Okay, do you have them with you right now?
Yes, wearing contacts.
You're wearing contacts, okay. So if she had anything that she would usually use that she didn't have right now, we could go ahead and grab those so she can better participate in the survey. All right, gag reflex. Okay, and do you know where you're at right now?
Yes, Hartnell College.
All right, now college. And do you know roughly what time it is?
About 3.
About 3, okay. So she's A&O, alert and oriented to name, place, and time. So LOC times 3. Alrighty, so after that, that's gonna be our neurological assessment. After that, we're gonna go into the cardiovascular, okay? So I'm gonna go ahead and take your pulse on both sides. Assessing for rate, rhythm, quality. We know that the rate is 64 beats per minute. It's strong and equal on both sides. I'm gonna go ahead and gently press down on your fingernails. Capillary refill both sides bilaterally is under 2 seconds. I'm gonna assess for any digital clubbing. Just look at the extremities. No clubbing present. Okay, I'm gonna go ahead and gently pinch together your skin, okay? I'm gonna assess for the skin turgor. Skin on both sides lays back down flat, and we're assessing for color and temperature as well. So warm temperature, good color, pale, cool, and diaphoretic would be skin signs that are poor. After that, we're gonna assess for any cyanosis around the oral mucosa or the lips. None present. We're gonna look for edema as well. So we're gonna look at the neck, the chest, as well as the extremities. No edema noted. If there was any, we can go ahead and press in with one finger and release, noting from a scale from 0 to 4 the amount of depression and the time it takes to come back out to normal. So no edema noted. We can also note for weeping edema if they have chucks underneath them or any fluids from coming out of the skin. I'm gonna go ahead and listen to your heart, okay? So that scope's gonna go under your gown. We're just gonna listen for the S1 and S2 present. Thank you. So, good heart sounds, strong, regular at the 64 beats per minute, and clear S1 and S2. Okay. So next, can I go ahead and have you cough one more time for me? Okay, so if she's able to cough up anything, any sputum, if it's a productive cough, we're gonna note the color, odor, consistency, and amount of sputum. None present right now. So then we're gonna sit you up on the edge of the bed, okay? I'm gonna lower this first for your safety. Can you go ahead and swing your legs over? Okay, let me know if you feel dizzy or anything. Are you comfortable there? Okay. So now we're gonna assess your respiratory function, okay? So just observing, can you go ahead and take a big deep breath for me? Okay. Assessing for AP and lateral expansion and depression on inhalation and exhalation, so we want it to be bilateral and even. We're gonna look visualizing skin, feeling as well for color, temperature, and skin signs. So you just want to observe. We have good color, warm temperature, and dry as well. So the next thing we're going to do is we're going to palpate, okay? So I'm going to take the ulnar aspect of my hand, and we're going to do it in 3 different spots on the front and the back, and you're going to say 99, okay? We're noting any tissue abnormalities in density, any air or fluids in the pleural space or lung that would decrease or increase the vibrations. Okay, can you go ahead and say 99?
99.
Thank you. Do the same on the back.
99.
Okay, thank you very much. So we are examining vocal resonance. Clear, no abnormalities. Okay, the next thing I'm going to do is going to be thoracic expansion. So I'm going to put my hands in a W wing shape on the back and the thoracic spine. And can you go ahead and take a big inhale for me? Okay. So assessing for the movement of my thumbs laterally away from the midline. So there is expansion about 3 centimeters. So now I'm going to go ahead and I'm going to palpate your chest, assessing for any tenderness, swelling. So let me know if anything feels more painful, abnormalities, as well as assessing for any crepitation that could be due to air on the subcutaneous layer. Any abnormalities? Any pain?
No.
Tenderness, swelling?
No.
Okay. Anything down here?
No.
That. Any tenderness, swelling?
No.
Okay. So, remember that. Okay, I'm gonna go ahead and percuss your chest now and then your back, okay? I'm gonna take 2 fingers and I'm gonna tap. I'm listening for the sound. It should be kind of a dull thud, making sure that there's no air or fluid in the lung where it should be. So not percussing over the scapula or any bony structures. Okay. So with no abnormalities. Last thing I'm gonna do, I'm gonna take lung sound for you, okay? So we're gonna take 4 on your chest, 4 on your back, and then 2 on each side and 1 over your throat, okay? I'm gonna start from the bottom, all right? Take a big deep breath in through your mouth. Thank you. Big deep breath. Thank you. Thank you. Now we're gonna do the same on your back, okay? Deep breath. Okay, thank you. I'm gonna take 2 on each side, all right? This one's gonna be mid-axillary as well, but closer to the armpit. Okay, thank you very much. Last breath sound we're gonna do is gonna be over your throat, okay? Take a nice deep breath through your mouth. Perfect, thank you very much. So clear breath sounds in all quadrants and lobes. No stridor in the upper airway, or wheezing or crackles in the lower airways or alveoli. Okay, at this point I'm going to go ahead and one more assessment for color, temperature, and skin signs. So we're looking good. I'm going to go ahead and help the patient back into bed. Can I help you lay back down? Alrighty. I'm going to go ahead and return everything to normal. I can open up the curtains, turn back on the TV, place everything that she had before, whether it be bedstand and call light. Invite the family back in. I can go ahead and notify the nurse or physician of any pertinent info, as well as chart my data. Is there anything else I can do to help you today?
No.
Okay, I'm gonna go ahead and take off my clothes or my gown. Disinfect my stethoscope. And I'm going to sanitize my hands and exit the patient's room.